Hi, my name is Chylsi Summers. I'm with VTHT 1345, Radiology, spring of 2020. Here is my ID. And we are going to do the AVMA Radiology video project. Here I have Dr. Russell Johnston with me. He's going to ask me the questions for the video.
What is a radiation monitoring device called?
A dosimetry badge.
How does it work to measure exposure to radiation?
It measures the ionized radiation, and we have film badges that have a small film in them, and it is in a light-proof envelope that measures the exposure to radiation.
How do we obtain readings?
We send it to the manufacturer that we get the dosimetry badge from, and we send that in quarterly, and they send us a report back that I will show you here in a second.
When should it be worn?
It should be worn anytime anybody is taking x-rays that are going to be exposed to any radiation.
Where should it be worn when taking x-rays?
It should be worn on the outside of the leg gown at thyroid level.
What is the MPD for veterinary staff annually?
Annually, the MPD is 5,000 milligrams.
Can you show me the dosimetry readings of one of the team members?
Yes. So here we have our Patterson radiology report. So my name is here, and then right here it says the current dose of the deep, which means the deep tissue, and it says ND, which means non-detected. Then we have the eye, which is showing ND as well, which means non-detected. Shallow, which means the skin is non-detected for our current dose. Then we have the lifetime dose, which the deep tissue, I have 89. The eye is 99, and the shallow is 99, which is still under the 5,000 milligram that is limited annually.
List and explain 3 methods of restraint used in radiology.
3 methods used in radiology for restraint is manual restraint, which means the person is physically restraining the pet during the radiograph. So holding them on their side laterally, or pulling their limbs caudally or cranially. Then there is non-manual physical restraint, which means you are using positioning aids. So that could be the VTHT, which helps align them, straighten them during ventrodorsal x-rays. There is rope that you can use to pull their limbs so you're not holding on to their limbs and getting that exposure. And there's tape, gauze, any of that to help hold down the limbs so you're not in the primary beam.
Discussion showed 3 positioning aids that are used in radiology.
So one positioning aid is tape, and that you can use to hold down the limb so they're not able to move it, and hold down their body parts so that you're not in the primary beam. The other one is rope, so you can tie this onto their forelimbs, or to just pull it to make them straight so you don't have to hold on to their physical limbs. And then we have the VTHT, which just helps straighten them out to get the ventrodorsal x-rays.
Discuss physical protective barriers that can be utilized in the radiology suite other than PPE.
There is lead walls and lead shields that can be used to hide behind during exposure taken.
Explain how distance and exposure time setting on the machine can be utilized as safety measures.
The more distance you are away from the primary beam, the less scatter radiation and exposure you will get. The time setting depending on the machine. The higher the MAs and the lower the seconds, the less exposure time that you'll get exposed to.
Explain why no portion of any human, shielded or unshielded, should be exposed to the primary beam.
The primary beam is very dangerous in that anytime you are physically in the primary beam, like with a hand or a finger or anything, that ligament is being exposed to radiation. The PPE is just to help protect against scatter radiation, not protect against the primary beam that can cause significant damage to your skin and your cells.
Explain why non-essential personnel should be removed from the X-ray suite during exposures.
Non-essential personnel should be removed from the radiology suite just to help keep their exposure down when taking radiographs.
Explain why we should make every effort to obtain diagnostic images on the first exposure.
You always want to check twice and expose once. That way it limits the exposure to the patient and the people in the taking the radiographs.
Explain the scientific reasoning for restrictions on pregnant women and people under the age of 18.
So, under the age of 18, they are still developing and growing. So, if they are being exposed to radiation, that can cause harm in their cells, and it can cause cancer and other really terrible things. With pregnant women in their first trimester, that is the most important part for developing a fetus. So you want to make sure that they aren't exposing themselves or the fetus to any radiation because they're still growing and developing. Now we're going to take a look at our PPE. You want to visually inspect for any scratches, holes, any tears or anything like that before every radiograph taken, just to make sure that you are fully protected. So we have our lead gown here, and then we put it on like this. And tie it. And then we have our thyroid shield, and it goes around the neck. Dosimeter badge that is going to be clipped to the thyroid collar at thyroid level. And we have gloves, lead gloves, but you really have to check these because patients can bite them and leave holes in them, so you want to make sure that there is no holes or tears in them. They look good. We go on like this. You can also have safety goggles, which we don't have here. We just look away whenever we are shooting the exposure away from the primary beam. And that is PPE. Now we're going to do the radius ulna x-ray. So here we put in our patient information. The ID goes here, the ID number, and then we have the patient's name, which he is already in our system, so we can just hit search and he pops up as our clinic pet CRPH baby Huey. And then the request department is Dr. Russell Johnston, and we click next. And then we want to go to domestic forelimbs, and we are going to do this one, the CC of the radius ulna, and then hit next. So you want to measure at the mid shaft of the radius and between the radius and the ulna. Okay, and it's measuring at a 2 on the caliper. And then we're gonna go to our technique chart over here. You find extremity, and 2 is 46 for the KVP, and 10 is the MAs. So we move the MAs to 10, and the KVPs to 46. It's okay. Alright, so now we want to place the patient in ventral recumbency. So I'm going to have them lay down here. For my positioning aid, I'm going to use some tape. And we're going to position his leg just to help hold down so our fingers aren't going to be in the primary beam. We're going to put in our marker. And make sure he's as straight as possible. Deflect his head out of the way. And then shoot our exposure. Good boy. Okay. So now we have the radiograph. Now we're going to do the VD of the thorax. So we have the caliber here, and we're going to measure at the last rib. So he is 27 centimeters. Now we look at our technique chart, and he was 27, which is not on here. So it's going up by 3, so we just add 9, which is 108. So that 108 is KVP and 5 is MAs. So we're going to come back to this. And we're going to turn the seconds down for the MAs to 5 and turn the KVP up to 108. Okay. Now we will put him into position. So we're going to use the VTHT again as our aid. VD, ventrothoracic. You collimate at the thoracic inlet, the first vertebrae, and then make sure the body wall is in there with the VTHT. You're gonna put the right marker label at adjacent to the axilla. Adjacent to the axilla. So we're gonna put it right there. Christina's gonna pull him cranially, and I'm going to pull him caudally. And we want to make sure that the midline is straight. And do our exposure. Okay, so here we have the VD of the thorax. So we got the heart in there. And yeah, so it looks like a good x-ray. Okay, now I'm going to put the x-rays in that we need to do the pelvis x-rays. So we have our patient work file here. We use the digital x-ray system. So up here with patient ID, you're gonna type in their ID number. And then over here in the patient's name, you type in their last name first. And then their first name, the pet's name. You select whether it's male or female. You enter their birthday. And then who is requesting it. So Dr. Russell Johnston is going to be the one requesting it. You push the next button. So we are gonna do pelvis, and we are gonna do canine VD. And then push this green arrow to start the study. Okay, now we're gonna measure him with our caliper. We want the widest part of the pelvis. So he is 26 centimeters. And then we're going to use our technique chart. So you find pelvis, and our technique chart doesn't go to 26, but you can add on to it because it's going up by 3. So it would be 88. Okay, so it will be 88 for the KVP and 10 for the MAs. So the MAs are already on 10, and you want to turn it to 88. Okay. And now we are going to position him. It's okay. And we're going to use our VTHT as in position 8. So we'll put we have him slightly positioned. We're going to put our marker, make sure our collimation is there. Okay, so Christina is my assistant. She's going to pull him as far to her as she can, and then I'm going to make sure his legs are parallel and put the right marker in. You want to make sure that it's just distal to the patellas, and you want to make sure the tail is lined with the spine. So you're going to rotate in the legs, pull towards me. There we go. All right. And then you're going to make the exposure. And look on here. Our marker didn't quite make it in, so we can add that in. We want to put the marker to the cranial aspect of the pelvis, so up here. And he looks pretty straight, so that is a decent radiograph. Now I'm going to show you how to look up the x-rays on our system. We have the Genesis OmniView digital x-ray system. So there's quite a few options up here. You can put in the patient ID number. You can put in the patient's name if you're not for sure what their ID number was. So we're gonna look up Chloe. And over here, hit search. And then we have a lot of Chloe's, but we're gonna look for Chloe Bradford. So we want the lateral of the abdomen from 6/19/2019. We'll just double click it and it opens those radiographs up for viewing. Up here it shows Chloe Bradford's name, and over here it shows the date that it was taken on, and down here it shows the canine lateral abdomen view. And that's how you look up the x-ray. Now we're going to take the previous x-ray for the barium swallow. It's okay. So we have him set up and ready for exposure. Good boy. So this is the beginning x-ray, the first x-ray, so we can see what it looks like before we give him the barium to see if he has a megaesophagus. Now we have our canned food with the barium, and we're gonna let him eat it. We already have our x-ray set up. You're okay, you can eat it. Our x-ray set up to be ready as soon as he's done eating. We want to take the x-ray so we get get it in the esophagus to make sure he doesn't have megaesophagus. Good boy.
That's good.
Okay. And now we're going to take the x-ray. So we'll put him back on this side for the lateral view. You're okay. You're okay. marker in. So we are gonna position him and make sure that on there it shows it's ready. Down a little bit. Now we have our second film. So right here we have just a little bit of the barium left, but most of it already went to his stomach. So that means he has no megaesophagus. And that's how you do a barium swallow.
Hi, I'm Russell Johnston, DVM, owner of Chylsi Summers Pet Hospital. I've been a preceptor for Chylsi for her classes. She has been taking x-rays for us for several years, and so she knows, she's very familiar with the computer program and getting that set up, getting the pets into the proper position, measuring and getting the proper technique. Before the class, she may not have known a lot of the terminology, but she knew what to do to get the images we were looking for. But the class has certainly helped her have a better understanding of why we do things, why we get certain angles, and the proper terminology for the different positioning, and the class has also helped, we get into our habits of how we take x-rays, and it's helped her see new ways of trying to limit the radiation exposure to the people. So her strengths are getting the x-rays done, getting good images, weaknesses, sometimes she's a little reluctant to commit to this is a good image, and wants a doctor to review it before she sends it across, but it's always good, and it's easy to add a second image always. So I don't know of any other weaknesses to point out at this point. As like I said, she's been doing this for she's been an employee here for 6 years, and helping others with x-rays, and now having other people help her. So she assists her with the x-rays as she takes care of them. So the end.